Please start the session, sir. We are live.
Good evening to all. This is Chandramohan, ortho physiotherapist from Sri Samraj Physiotherapy Center, Dindivanam, Tamil Nadu. A warm welcome to all for the ExRxIndia's and Sri Samraj Health Services Private Limited's presenting WEBATHON, a web series, endorsing for the world record in the field of physiotherapy, not just counting on the topics but responsibly providing the knowledge for the physiotherapist, and also recently MBBS, BDS, BOD all are joining in our program. And participants are from India and 20 plus other countries, few joining a Zoom meeting and mostly are watching through our fitness and rehab India YouTube channel. Apart from this, ExRx India is providing online OG consultation for the women's health related issue in association with Pickle Studio Chennai, Dusat Creations West Bengal, powered by Fitness and Rehab India YouTube channel. Before announcing topic and resource person, I would like to thank Dr. Vijay Kumar for suggesting me to reach our resource person. And also, one among my well-wisher, Dr. Mona Krishnan Sir's birthday today. I wish him a very happy birthday. Hope the message will reach you, sir. And I welcome ExRx India team members, Dr. Rupesh and Professor Duna, along with her team, Miss Simran, Miss Alisha, and Miss Uma. And now I welcome our resource person, Dr. Vishnu Vardhan, a PhD scholar, associate professor from Dr.A.P.J.Abdul Kalam College of Physiotherapy, Loni, Maharashtra. Please welcome, sir. Please commence the session.
Yes, sir. Good evening, sir. Good evening, all. Thank you, Dr. Chandramohan. Thank you, Dr. Rupesh and Professor Duna, for giving me another opportunity to conduct a topic, respiratory muscle training devices. So I'll share the screen.
Share your screen, sir.
Yes, I'm doing it. You're able to see the screen, ma'am?
Yes, ma'am. Yes, sir. We are able to see it. Please.
Okay, I'll start. So good evening, all. Yeah. The topic is respiratory muscle training devices. So weakness of the respiratory muscles is defined as a reduction in muscle contractility, resulting in inability of the respiratory muscles to generate normal levels of pressure and airflow during inspiration and expiration. So due to the weakness of the respiratory muscles, the strength could be, that is the respiratory muscle strength could reduce the exercise performance in healthy individuals, COPD patients, stroke, and heart failure patients. So studies suggest that respiratory muscle training devices has the potential to increase the respiratory muscle strength, exercise performance, and the functional capacity by repetitive breathing exercise against an external load. So the main objective of this webinar is I want to create awareness of the respiratory muscle training device, which is helpful in increasing your respiratory muscle strength. So today there are almost 14 respiratory muscle training devices which is available in the market. I'm just going to touch only a few devices which I felt like it will be helpful for you. And some may be new, some may be known. So first one is Threshold IMT device, POWERBREATHE Medic Plus device, POWERBREATHE Plus, POWERBREATHE K series, which is in this, there are almost 6 or 7 devices. I'll be only dealing with one device due to the time constraint, that is POWERBREATHE KH2. And the last one is breather device. Now we'll go for the first device, Threshold IMT. The Threshold IMT device is an inspiratory muscle training device, which are easy to set with an adjustable pressure in centimeter H2O. So you can see over here, this is a Threshold IMT device. It is having a spring-loaded valve inside, which is helpful in creating the resistance. And it has a minimum resistance of 9 centimeter H2O and goes up till 41 centimeter H2O. It is a one-way valve device. So parts, mouthpiece, one-way valve where the patient has to adjust the mouthpiece and has to inspire by creating a resistance. So pressure resistor INT device is a handheld device with a spring load that is impeded with different intensities. As I already discussed, there's a spring loaded valve which has different intensities with a minimum resistance of 9 centimeter H2O and goes maximum till a pressure setting of 41 centimeter H2O. So the gradings are from 9 to 41 centimeter H2O and allows resistance changes by 2 centimeter H2O increments. So indications of threshold IMT in mostly COPD patients, like mostly like according to like a grade 1, grade 2, according to Gold's criteria as per PFT, you can go for the COPD patients, chronic heart failure patients. This device is also used in athletes as well as in upper abdominal surgery patients where the diaphragm is mostly cut. So this device is helpful in increasing the respiratory muscle strength. Now, how do you fix the pressure settings? You see over here, the mouthpiece can be adjusted. At the same time, this red level indicator moves up. When it moves up, it creates more resistance. And when it moves down, it creates less resistance. So this by turning this mouthpiece can move up more resistance, down less resistance. Procedure. The patients begins training with a 30% of maximal inspiratory pressure and goes till 60% of current maximal inspiratory pressure. So the training should start with 30% of MIP. This term will be used throughout this webinar, maximal inspiratory pressure, which is considered as an outcome measure and goes till 60% of current maximal inspiratory pressure. Now, I'll give you an example how it is calculated. And this maximal inspiratory pressure, this is an outcome measure device. That is, before going for the threshold IMT device training, you go for this device this is micro RPM respiratory pressure meter, which shows how much is your inspiratory muscle strength by measuring the maximal inspiratory pressure. So how do you calculate? As I told you, the training should start from 30% of MIP. So before you go for the threshold IMT device, you have to give this device and measure the MIP. So before the intervention, so I call it as pre-MIP. So I got 52 centimeter H2O. Now go with the low training intensity, 30% of pre-MIP. So 30 by 100 multiplied by this pre-MIP is 15.6. So again I repeat, first you have to check the maximal inspiratory pressure. Before intervention, you have to give the device that is respiratory pressure meter, that is this device. Go for the reduced lower training intensity in case of patients, 30% of pre-MIP. 30 by 100 multiplied by 52 gives 15.6 centimeter H2O. So this has to be set. So once you get this 15.6 over here centimeter H2O, that's your maximal inspiratory pressure, you have to set here. You can see here this device 9, 11, 13, 15. So start with the lower intensity as per 30% of the MIP. So this is 15 centimeter H2O, and gradually you have to increase 15 after a week increase to 17 and 19. So always start the training with 30% of maximal inspiratory pressure in patients, and then you have to go forward. Okay, then after the training of maybe 4 or 5 weeks, then again go for the post MIP. Pre MIP by respiratory pressure meter, 30% of MIP, then followed by threshold IMT device training for 5 weeks, and then go for post MIP. This is just an example I'm giving to you. So hope so you understand. If you have doubts, at the end we'll clarify. So how do you perform it? The patient has to be seated in a comfortable position, place the lip around the mouth. The patient has to inspire through the device, at the same time expire through the device. and the spring loaded valve creates that resistance during inspiration. Benefits: it helps in increasing respiratory muscle strength, increases respiratory muscle endurance, and exercise tolerance. This device, studies says that it can be even connected to a patient in ICU in tracheostomy. So you can see here, this device is also connected to a tracheostomy tube. This is a simulated image, and again they are told this device can also be connected to an endotracheal tube. Now, if you want to connect the IMT device to a mechanically ventilated patient, there are some criteria which is given by Bissett and the corresponding authors. This is a study which was done in 2018 in Australia. In ventilator dependent patient, when do you go for this? That is, if the IMT has to be connected to an tracheostomy tube or endotracheal tube, the patient has to be alert and cooperative. That is, he must be very much conscious and oriented. PEEP less than 10 centimeter H2O. FiO2, that is fraction of inspired oxygen, should be less than 60 percentage on the ventilator side. Respiratory rate should be less than 25. And he should be able to trigger spontaneous breaths on ventilator. That is, the patient must be very much conscious, oriented, and he must be um, interacting with the ventilator. So mostly the mode is expected mode will be SIMV, CPAP, or BiPAP mode. So you understand, right? Patient has to be more conscious and oriented. Now, in case the patient is weaned off, you know what is weaned off? Disconnecting from the ventilator completely, the endotracheal tube is totally extubated. The patient can place the mouthpiece in his mouth and do the same procedure with respiratory rate less than 25. So this is a criteria on a ventilator dependent patient and a patient who was weaned off. Now let's go for the recent advances. Inspiratory muscle training for intensive care patients, a multidisciplinary practical guide for clinicians. So they are trying to create a guide. How can this IMT device be used in ICU patients? So as we know that if a patient is on mechanical ventilator for a long period of time, there are chances for inspiratory muscle weakness. So the patient who has experienced invasive mechanical ventilation, a patient who is on mechanical ventilator for more than 7 days, he can go for this inspiratory muscle training. At the same time, after he is weaned off, he can go for the IMT. A respiratory pressure meter, that is to calculate the maximal inspiratory pressure. MIP device should be connected to an endotracheal tube or tracheostomy tube to find the MIP. So what they say, you have to start with 50% of maximum inspiratory pressure. That is, we have already discussed. This is done by the respiratory pressure meter, that is the MIP device, which is connected to either the tracheostomy and endotracheal tube. They find the pre-MIP and then go for 50% of maximum inspiratory pressure. Okay, and then gradually you have to increase. So what they found out, threshold IMT device when used on mechanically ventilated patient, it helps to enhance weaning, at the same time improve inspiratory muscle strength and quality of life. So the evidences suggest that threshold IMT device can also be used in IMT in a mechanically ventilated patient who's having inspiratory muscle weakness. Okay, so this is one of the study which was done in the ICU. Yeah. Now, as I told you, indications, it can also be used in athletes, that is sports person. So this was a study which was done on young soccer players, football players. So they wanted to know whether this threshold IMT had a better effect in young soccer players. So it's a randomized controlled trial. So one is the experimental group. Threshold IMT device was given for a duration of 8 weeks, twice per day, 5 days per week. So initially week 1, 40% of MIP, week 2, 45% of MIP, week 8, 75% of MIP. So it was found that in the first week it was 40%. Slowly the max it has increased to 45%. And the end of 8th week it has increased to 75% of MIP. And in control group, they are used only the regular soccer training session without IMT. Experimental group, along with the soccer soccer training program, they are used threshold IMT device. What were the outcome measures? Pulmonary function test was one of the outcome measures, that FE1, FEC, maximum inspiratory pressure by the respiratory pressure meter device, which was used as an outcome measure, and Cooper test. You may be knowing what is a Cooper test. It's a test where I think the individual has to go run for 12 minutes, and the VO2 max is calculated. So what they found out after 8 weeks of training, it had, compared to the control group, there was an increase in inspiratory muscle strength as well as the expiratory muscle strength, and there was an increase in the VO2 max in the experimental group by the help of the Cooper test. So this study suggests that this threshold IMT device can also be used in sports person. Okay, so these are the recent advanced literature which is found. This comes end of the device called as threshold IMT. Now I'm going to the second device called as POWERBREAThe Medic Plus. POWERBREAThe Medic Plus, it is a device which is used for respiratory patients. There are two forms of device which is coming the next upcoming slide, that is POWERBREAThe Plus, but this is called as POWERBREAThe Medic Plus, mainly used for healthcare professionals. It has a minimal load of 9 centimeter H2O. It can be used in COPD patients, asthma patients. Now, as I told you, it has a minimal load of 9 centimeter H2O. So we will go for the parts. So before going to the parts, you see over here, this is the spring loaded valve. Level 0 minimal, level 10 is maximal. So I'll come back here. Level 0 minimal, level 10 is maximal resistance. So 0 is, level 0 indicates 9 centimeter H2O, and level 12, that is maximum, it is 78 centimeter H2O. So it has a loads of resistance that is 9 centimeter and goes maximum till 78 centimeter H2O. So coming to the parts, this spring loaded valve is attached down, what you see over here, and this is a mouthpiece the patient has to inspire. The nose clip is there. This is the internal level indicator sleeve, which indicates the resistance, whether 0, 2, 4. And this is how you have to, this is a load adjustment knob. You have to rotate it so that this moves up. I hope you understand the parts of a POWERBREAThe Medic Plus device. So this is the load adjustment knob. Rotate anti-clockwise, clockwise. This moves up and this moves down. So POWERBREAThe Medic Plus device has its adjustable load settings. Level 0, the minimal is 9. It has level 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Level 10, the maximum goes to 78 centimeter H2O. So starts with the level 0 and goes till level 10. So same protocol, you have to see the pre-MIP by the respiratory pressure meter device and then set the load settings. We have already discussed the parts. Indications is almost same. It can be used in pulmonary thoracic surgery. It helps in ventilator weaning, cystic fibrosis, and in some neuromuscular disease patients. Contraindications, yes, we don't go for pneumothorax because of the air accumulated in the pleura. And then rib fractures, we don't go for this device. How do you go for the procedure? You can see over here, the knob is rotated clockwise so that the training level increases. The level indicator sleeve increases, and when the training knob is rotated anti-clockwise, the training level, that is the level indicator sleeve decreases. So load adjustment knob increase clockwise, it's going to increase. Anti-clockwise is going to decrease. Okay. So same time, this level indicator will indicate where is the load, whether it is 0, 1, 2, or maximum till 10. So as I told you, level 0 is almost 9 centimeter H2O. Level 10 is 78 centimeter H2O. So the patient has to inspire and then expire to the device as per the load. He can even use the nose clip so that he concentrates more through the breathes through the mouth rather than the nose. So coming to the recent advances, this it was moderate to high intensity inspiratory muscle training improves the effects of combined training on exercise capacity in patients after CABG, a randomized clinical trial. So this device was used in CAB post CABG patients of phase 2 cardiac rehab program. It was published in the year 2019 in the journal International Journal of Cardiology. So the aim was of the study was to investigate the effects of 12-week moderate to high intensity IMT training, that is by PowerBreathe Medic Plus, plus combined aerobic and resistance training. And these are the outcome measures: quality of inspiratory muscle strength, quality of life, and CABG patients. So CABG patient mostly, if you see, like we are training for the we are going for phase 2 cardiac rehab program. We are mostly concentrating on aerobic and resistance exercises. So in this study, this RCT study, randomized control trial, experimental group, they have gone for a Power Breathe Medic Plus device. That is, they've gone for this device. Initially, they have started with 50% of maximal inspiratory pressure during the first 2 weeks, and they have progressed to maybe maximum till 80% of MIP with a combined training of aerobic and resistance training. This is for experimental group. And control group, they have gone for sham IMT with a minimal load of 9 centimeter H2O. Sham IMT means they have used the same device in the control group, but they have kept the load constant, that is 9 centimeter H2O. That is the load, that is the level indicator sleeve is set only at 0. They have not increased the resistance. That is what is called a sham IMT. I'll come back here. So experimental group, they have increased the resistance from 50% to 80%, but in control group, they have kept a load constant of 9 centimeter H2O. That's why it is called a sham IMT with combination of aerobic and resistance training. What were the outcome measures? Peak VO2, submaximal functional capacity, respiratory muscle strength, inspiratory muscle endurance, and quality of life. It was 2 times per week for 12 weeks, total 24 session. So after CABG, usually there is reduction in inspiratory muscle strength and lower MIP and MEP values, that is maximal inspiratory pressure and maximal expiratory pressure values. In this group, there was a significant improvement in MIP as well as inspiratory muscle endurance in experimental group compared to the control group. So what they try to say, after the training with PowerBreathe Medic Plus as well as the CT, that is a combined training of aerobic and resistance training, this group, that is the experimental group, had a better improvement in inspiratory muscle strength and quality of life as well as the functional capacity in CABG patient. So yes, this is evidence suggesting that IMT can also be used in CABG patients. Now we come to the end of the second device called as PowerBreathe Medic Plus. Now I'm going for the third device called as PowerBreathe Plus. So this is the device over here. It's almost similar to the PowerBreathe Medic Plus, but how it is different from other devices, I'll try to explain. It has the same. It has the same 11 adjustable pressure settings as the similar to PowerBreathe Medic Plus, but it helps to increase stamina and overall wellness. So be very clear. It helps in increasing stamina and overall wellness. So what are the parts? Similarly, same spring-loaded valve, mouthpiece, calibrated resistance spring. Now there are color codings in PowerBreathe Plus. PowerBreathe Plus light resistance, LR light resistance, PowerBreathe Plus medium resistance, and PowerBreathe Plus heavy resistance. So it is green for light resistance, blue for medium, and red for heavy. That is the PowerBreathe Plus green. It is used for wellness, where the load that is at level 0, it starts with 17 centimeter H2O and goes to level 10, that is 98 centimeter H2O. And next one is PowerBreathe. This is the PowerBreathe Plus medium resistance, which is used for fitness, with a reduced with level 0 indicating 23 centimeter H2O, level 10 186 centimeter H2O. And the POWERBREATHE Plus heavy resistance for sports performance starts with 29 centimeter H2O and goes till 274. So wellness POWERBREATHE Plus light resistance for anyone who's at the entry level. Second one, for a fitness person who goes to gym on a regular basis, he can go for POWERBREATHE Plus medium resistance. And one who's an elite sports individual who's very active in sports, he goes for the POWERBREATHE Plus heavy resistance, starting with a load of 29, and he can go till 274. So level 0 till level 10. That's what is indicated over here. So what are the indications? When do you go for POWERBREATHE Plus light resistance? If the person who is physically active for less than 2.5 hours per week and has no breathing problems, sometimes if he is having minor breathing problems, or he is active more than 2.5 hours per week but has severe breathing problems, that is at the entry level, you can go for this POWERBREATHE Plus light resistance, which has a load settings of 17 centimeter H2O till 98 centimeter H2O. POWERBREATHE Plus medium resistance, who is physically active for more than 2.5 hours per week, no breathing problems. He may be having, excuse me, physically active for more than 2.5 hours per week, but some breathing problems that are not severe. He can go for POWERBREATHE Plus medium resistance, load of 23 centimeter H2O to 186 centimeter H2O. The last device, POWERBREATHE Plus heavy. If the patient is able to complete the maximum load of 186 centimeter H2O, then he can go for the POWERBREATHE Plus heavy resistance. That is, if the individual has reached the highest load setting on a POWERBREATHE medium resistance, then he can go for the red device, that is POWERBREATHE Plus heavy resistance. That indicates if he is able to successfully complete the POWERBREATHE Plus medium resistance, then he can go for POWERBREATHE Plus heavy resistance. That's the difference. The procedure is same. Inspiration, place the nose clip. The patient has to set the pressure settings as per the maximal inspiratory pressure, and he can go for 30 breaths per day, inspiratory and expiratory. So again, this is the difference of POWERBREATHE Plus light resistance, medium, heavy, level 0. You can see it's light is 17, 23, 99, and you can see the maximal level 98, 186, and 274. So POWERBREATHE light resistance for entry level, who is not that much physically active, he wants to start at the early stage. One who is fit, and that POWERBREATHE Plus heavy resistance is usually indicated for sports performance athletes. So this is a difference between light, medium, and heavy resistance. Coming to the recent advances, impact of early pulmonary rehabilitation on post liver transplantation patient. So this study was done in Egypt. The study was to conduct the impact of early pulmonary rehabilitation for post liver transplantation patient. So they have used this POWERBREATHE Plus device in liver transplantation patients as a part of traditional physical therapy program. The program was done 14 sessions per week, twice daily for 21 days. The outcome measures were ABG on the first day was taken, 7th day and the 21st day, and the other outcome measure was 6-minute walk distance. So when the POWERBREATHE Plus was used on liver transplantation patients. So they had conducted the study for almost 21 days, 14 sessions per week, twice daily. So what they found out, the patient had a better improvement in PCO2. The PCO2 come back to normal. The PO2 had increased, and HCO3 is also come back to normative levels. And there was an improvement in the 6-minute walk distance in patient. So this gives an evidence that POWERBREATHE Plus can be used even in the liver transplantation patients, which was done in Egypt. Yeah, so that's what it is shown. It helps enhances patient compliance and independence. Now, this is another study, safety and efficacy of inspiratory muscle training for preventing adverse outcome in patients at risk of prolonged hospitalization. It was done in the year 2017. So the objective of this clinical trial was to assess inspiratory muscle training on hospital inpatient complication. So what they tried to do in this study was they tried to use this POWERBREATHE Plus device when the early stages, like the patient is admitted in a hospital, they try to start this training at the early stage, and this they see for the they tried like by using this device how it prevents in hospital inpatient complication and reducing the length of stay of the length of stay in the hospital. So it was a 4 weeks training program with a load of 50% of maximal inspiratory pressure. So the experimental group used this inspiratory muscle training using a POWERBREAThe Plus device, and the control group, they used this device but performed unloaded exercise, that is sham inspiratory muscle training. What they are trying to say is, in the experimental group, they had the spring loaded valve where the resistance was there, and in the sham group, the device was used, but this spring loaded valve was not present. So one group, they gave the device and the resistance was set, and in another group, that's the control group, the spring loaded valve was removed and it was given. That's it's like a placebo effect. It was given. So they wanted to see what was the effect. So they found the Apache score, outcome measure by Apache score, the Barthel index, functional independence measure, and MIP, that is maximal inspiratory pressure. So they found that this PowerBreathe Plus device, which was used in experimental group, had a shorter mean length of hospital stay in patients, lower risk of endotracheal intubation, and improvement in inspiratory muscle strength. So what they try to say is, by using this device in the early stages, the patient complication, that is inpatient, that is the length of hospital stay was reduced. There was less risk of endotracheal intubation. At this device was helpful in the improvement of inspiratory muscle strength. So this study concluded that PowerBreathe Plus device is effective in preventing complications due to prolonged hospitalization. So this comes end of the almost the fourth device called as PowerBreathe Plus device. Now this device was something new to me. It's called as PowerBreathe KH2. The first time I was seeing this device, although it has come in the year 2010, it has been widely used, but it was something new to me. It's a digital training device. It is an electronic digital inspiratory muscle training device. It is intended for use by healthcare professionals for inspiratory muscle training and assessment. This device is used bedside on a hospital ward as a part of pulmonary rehabilitation program, and it uses an electronically controlled rapid response valve to create resistance to inhalation. So what they say, this PowerBreathe, what you see over here, the mouthpiece, it is a digital inspiratory muscle training device, and you can see it's almost like the mobile phone handset, where you see get all the readings over here. So it creates a visual feedback. Okay, the parts, mouthpiece, handset. This is the LCD screen which indicates all the readings. And the important thing is this PowerBreathe KH2 can be connected to a laptop. So this is connected to a laptop. One side is connected over here, and the other side is connected. Side is connected to the device, and the other side is connected to the laptop. So you can see all the readings in the laptop. So it is creating a positive effect. It creates a motivation for that the patient sees a visual feedback and he's able to do it. That's the advantage of this device, which was not seen in other devices. I'll try to explain the screens what is present. So you can see that there's a power button on and off, and the patient can scroll here, test, results, options. I'll try to explain whatever is there in the the screen. So this is a screen which you see here of the device tests. So what can be seen? MIP, that is maximal inspiratory pressure, peak inspiratory flow. The patient can see the results by pressing this button. Press this button, you get the results. You can see all the training results, options, the modes, level, pacing, setup, and he can, this is the on and off. So I'll be explaining what is this test mode, the results, and the, sorry, I'll be using, and the options. MIP, PIF, training, I'll be going one by one. First one, as we had already seen, the test is MIP, PIF. and then the results. I'll start with the levels which we saw over here. This is a level which you see here. There are two levels. One is automatic setup, and the other one is manual setup. So automatic setup is the patient can automatically set his resistance. That is, I'll try to read from the literature. This device will automatically estimate the patient's training program at the beginning of every training session. Training load is calculated using the peak inspiratory flow and the maximum inhaled volume from the first two breaths. So, what I'm trying to explain is the patient inspires, the diaphragm contracts, that is called inspiration. So, automatically the resistance is set. That is called as automatic setup. The patient inspires as well when the patient inspires, it automatically sets the resistance. That is called as automatic setup. Okay. And second one is called as manual setup, where in manual he fixes the resistance. That is, now I want to fix like it is 50 centimeter H2O. I want to increase it, so he can increase manually by pressing the manual button. That is, press this. He can increase or decrease by 50 to 51. That is called as manual setup. That is, the patient can fix the resistance. That it is under his control. But over here, the patient can automatically set up, like he can automatic means he can adjust the resistance in an automatic setup mode, which I'll try to explain in the upcoming slide. Now results. After he has performed performed a breath, he sees the results over here. That is load, power, volume, and energy. So I'll explain what is load, power, volume, and energy. Load is the measure of resistance to inhalation. That is how much centimeter H2O resistance to inhalation, and represents the pressure generated in the airways due to the force of inspiratory muscle during a training session. That is actually, it represents the resistance to inhalation. Power. Power is a measure of muscle performance which combines strength and speed of movement, pressure into flow. Volume is a measure of the average amount of air inhaled per breath during a training session. And energy is a measure of the mechanical work or effort of breathing during your breathing training session. So over here, after a single breath, after the patient inspires and expires, you will be able to see the results of load, power, volume, and energy. I have mentioned the definitions over here. So once he has done, now he has gone for inspiration and expiration, then it shows how much was the load, 100 centimeter H2O, the power, energy 673 joules, volume 4.3 liters. So this device is giving a visual feedback of load, power, volume, and energy. Now coming to the test mode, which I had mentioned earlier, I'll come. So I have dealt with the results. That is, we had seen the automatic. That is, results is that load, power, volume, and etc. Now coming to the test, which this one, which I want to say, MIP and PIF. Okay, so how it is measured? Test modes are maximal inspiratory pressure. So you get the MIP in this device automatically. It's a simple way to gauge inspiratory muscle strength. That is, that gauge means it is able to visually display the inspiratory muscle strength. You need not, like in the previous device, we had to use a respiratory pressure meter to find the pre-MIP and post. But in this, it has an inbuilt MIP. It is helpful to find the peak inspiratory flow test. That is, it's a measure which reflects the ability of the inspiratory muscles to contract rapidly to overcome the inherent resistance and elastance of the respiratory system. At the same time, it shows how much is the strength index, S index. It helps in measuring the inspiratory muscle strength. So over here, the patient go for the test, goes for the MIP, he presses this and he gets the load. So by pressing this MIP, he gets the result of how much is the load. That is 140 centimeter H2O, and there is some grading from very poor to excellent. So this is around 140 centimeter H2O, which grades as good. After this, he tries to calculate how much is the PIF, that is peak inspiratory flow, that is almost 6.8 liters per second. It gives a result, as well as how much is the strength index, that is the inspiratory muscle strength, and it shows the grading. So this indicates about the MIP test mode and PIF test mode. As I told you, this device has an added advantage. It can be connected, this USB is connected to the device of this PowerBreathe KH2, and it can be connected to the laptop. So as I told, this a laptop which gives all the readings, where the patient can store the files. He can see the data of last 30 sessions. Every data is stored in it, so it's not like uh, every day he has note on a paper. It is already, it has its own, it has its the data cable which helps in storing the data. So this is the data. It shows how much is the maximal inspiratory pressure. Although I have not used this device, whatever literature I found it, I'm trying to explain. Maximum inspiratory pressure. It has the strength index, which is seen over here. It is displayed. Although it is blurred, I'll try to explain. So now the patient, this is the visual. There's a dashboard which shows the screen. Now the patient has now, it has over here. It has a it has shown from 1 to 10 breath. It shows the data of 1 to 10 breath. Now the patient is going for the sixth breath, 1, 2, 3, almost 6. That's why it is showing 0.6 of 10 breaths. And it shows how much is the resistance of 115 centimeter H2O. At the same time, when the patient is going for the sixth breath, it's like a speedometer, which shows how much is the power, that is the average power. It shows inspiratory flow and the inspiratory volume. So in a simple term, because as I told you, something new to me also, so it is connect this device, the PowerBreathe KH2 device is connected to the laptop, and he sees all the readings of the on the on the laptop. So it shows the maximum inspiratory pressure, MIP, the strength index, all the graphs are shown, so that the patient is knowing how did he do yesterday and how much improvement is there today. So one of the recent advances is done of respiratory muscle rehabilitation in ICU in a patient of prolonged mechanical ventilation. So this is the PowerBreathe KH2, which is connected to the filter to prevent the cross infection. Normally a filter is connected and is directly connected to the patient, to the tracheostomy tube. So you see over here, the PowerBreathe KH2, if you see here, is connected to the tracheostomy tube of the patient. And while connecting to the tracheostomy tube, the patient inspire the same time is connected to the laptop, and he can see the visual feedback. So that is what I'm trying to say. This device gives a visual feedback on the laptop. It also gives this screen, a small screen which is seen over here. It shows all the data. At the same time, it gives the advanced data through this laptop, and this data can be stored in day-to-day basis. So what they found out, this device is well tolerated in ICU and gives more data on the maximal inspiratory pressure and breathing tidal volume. And this new technology can provide visual feedback on a computer screen. And it shows better guidance for the training for the physiotherapist, because definitely if we use this device, definitely we come to know how much improvement was day 1, day 2, day 3. And it also gives a motivating factor for the patient. That's the advantage of this device. Okay, and same device was used in ICU in the year 2017, and this was a study where there were two methods. One was the same device, inspiratory muscle training device, but EIMT. They have used electronic inspiratory muscle training device, that is by PowerBreathe KH2 in one group. Other group were used only intermittent nebulization program. So what they found out, right? They found out that the group which was using PowerBreathe KH2 device had a better improvement in maximal inspiratory pressure, and the weaning time was reduced compared to the control group. That's what this study says of inspiratory muscle training in the ICU, a new perspective. I hope so you understood PowerBreathe KH2. At the end, you can ask doubts. I will come to the last device, that is called as breather. This device, you can see here, it is used both for inspiratory and expiratory muscle strength. That's the advantage of this device. So many devices which we had seen before, it was used only for inspiratory muscle training. This breather device is used for inspiratory as well as expiratory muscle strength. That is why it is used. It is used during both phases of breath cycle. So when I'll try to explain. So this is how you change the resistance pressure setting. For inhalation, it has 5. This is for exhalation. And we'll go here. This is for inhalation. Knob 1, 2, 3, 4, 5, 6 for inhalation. For exhalation, it has 5 knobs. 1, 2, 3, 4, 5. So according to the knob 1, it is around, as it's an inhalation negative pressure, minus 10 centimeter H2O goes till minus 52 centimeter H2O. For exhalation, starts minimal with 5 centimeter H2O and goes till 31. So you see over here, inhalation, there are knob 1 going till maximum till 6. Exhalation 1 goes till 5. These are the pressure settings for setting 1 and goes till setting 6, setting 1 and goes to setting 5. And these are the pressure settings set as per the maximal inspiratory pressure. The benefits, we have already discussed the benefits. The one benefit they say, this breathing device, it also it uses the pharyngeal and laryngeal, that is, it generates improved airflow through vocal fold. That's what they say. So it is used in all the in stroke, Parkinsonism, as well as chronic heart failure patients. It can be done along with the diaphragmatic breathing protocol. The patient has to place the hand in the abdomen, inspire along with the device. The patient is seated in a comfortable position. The patient is instructed to breathe in and out to the device using the diaphragmatic breathing. The patient can rotate the inhale setting 1 to 6 and exhale setting 1 to 5. Increase the inhale and exhale settings independently of each other. That is, both the inhalation settings and exhalation settings can be set independently. And a set of 10 breaths is encouraged in this patient. Training sessions 6 days per week. Coming to our recent advances, this study was done in a stroke patient. As I told you, it also uses it helps in increasing the strength in muscles of dysphagia, that is swallowing. So this study was done in stroke patients. Experimental group had used RMT with the breather device, and the control group did not use the breather device. 4 weeks training program. The outcome measure, mostly they were concentrating on the swallowing scale. So man assessment of swallowing ability, fiber optic endoscopic evaluation swallowing, penetration aspiration scale, functional oral intake scale, VAS, and peak expiratory flow. So all these scales are something connected to the dysphagia scales of swallowing. So what did they found out? They started with 50% of maximum inspiratory pressure, 4 weeks of respiratory muscle training with the breather device, improved peak flow, and the main thing, improved swallowing function by assessing the swallowing ability food intake in patients with CVA. So they say it also improved the function of laryngeal and pharyngeal muscles used for speech and swallow. So this device was considered to be effective in stroke patient and at the same time improved sign and symptoms of dysphagia. Now the revision of all the devices. Threshold IMT, PowerBreathe Medic Plus, PowerBreathe Plus, PowerBreathe KH2, and breather. So if you see here, threshold IMT starts with the resistance of pressure 9 centimeter H2O goes till 41 centimeter H2O. PowerBreathe Medic Plus, which is used in the respiratory patients, again starts with 9 centimeter but has an added advantage of 78 centimeter H2O. This is used for the individuals who are fit, as well fitness like a sports person, like light resistant, that is a green one, 17 centimeter goes till 98. The blue, that is Power Breathe Plus, medium resistance, starts with 23, goes till 186 centimeter H2O. And the red one, that is a heavy resistance for elite sports individuals, goes from 29 centimeter H2O till 274 centimeter H2O. And over here, PowerBreathe KH2, it has a wide range of 0 till 200 centimeter H2O. As I told you, this is a digital training device. It adapts as per the patient's inspiration and expiration. Breather device is used both for inspiration and expiration. Starts with 10, goes till 52 centimeter H2O. Exhalation 5 goes till 31 centimeter H2. This is about the comparison of resistance setting of all the 5 devices. Now benefits, all threshold IMT, PowerBreathe Medic Plus, PowerBreathe Plus, and the PowerBreathe K2 are all used for inspiratory muscle training, but this breather device is used for inspiratory as well as expiratory muscle training. Now completed the whatever new which I had seen. Now these are the other devices which I'm, because of time constraint, I'll not be covering it. These are called PowerBreathe K series. That is K1, K2, K3, K4, K5. This is available in net. You can please go through it. Okay. This K1 is the entry level, and K5 is for sports person. That's why it starts with 1, 2, 3, 4, 5. It has its special color codings. This is completely different from, like, completely means KH2 is for power breathe, KH2 is for respiratory patient. This is used normally for patient individuals, normative individuals. K4 is for sports performance persons, as well as K5 is for elite performance individuals. These are the other devices which you had seen in the net, which I'll not be covering. This is used specifically for expiratory training. The other one is called a strain air device, P-flex device, origin dual valve, which is used both for inspiratory as well as expiratory. Power lung, again, it has its own color codes, which is used for inspiratory as well as expiratory. This is called RespiFit S. This is also a digital inspiratory muscle training device. These are the other endurance devices. So inspiratory muscle training is also there. Now, if you want to go for endurance muscle training devices, this is called as Pyro Tiger, and it's a lung boost respiratory muscle trainer device. So these devices are all for endurance training devices. So there are almost, in literature, there are almost 14 devices in the which is seen in the market. So right now I'll conclude the session. Yes.
Thank you so much, sir. Wonderful
Yeah.
session it is.
Yes, sir.
We will move on to question and answer session.
Thank you, sir.
Rupesh, Rupesh, are you there?
Yes, sir.
Yes.
Any questions, dear participants? Ma'am, any
I've got a
questions
question
in...
in YouTube.
Yeah, ma'am.
I'm pasting here.
Yeah, question from Vijay Nambi. Is IMT devices indicated for special children population like cerebral palsy, autism, etc.?
I may have to go for literature if so. I'm not aware of it, but I think it can be used in cerebral palsy patients. At the initial, yes, they can. It can be used. It can be used, but I should go for the recent advances on pediatric population. I have not gone through the literature, but I feel that yes, as part of the protocol, go for the limited load and go for the inspirate. Like you can go for threshold IMT device. It can be used. Yes, it can be used.
Yes.
Patient should first understand how to do, and then he can be encouraged to use it.
Fine, sir. Fine.
Is Muralidharan there?
Not there, I guess, sir. I just checked.
Okay. Any other questions?
Yeah, from Miss Jyoti Naidu. Is it mandatory to measure PI max before giving inspiratory muscle training, sir?
Yeah, it is definitely PA max is the one which is used to assess the strength of the inspiratory muscle. As I gave an example, PA max is measured by the respiratory pressure meter. So first pre MIP take the readings, and then you have to set the load. Now I'll try to explain by giving an example. If those who didn't understand, I'll just share the screen.
Yes, sir.
Yeah, just a minute. Because some might not have understood that, so I'll try to explain. So this is the you're able to see it now, sir? Yeah. This is the respiratory. This is the MIP device measured by micro RPM respiratory pressure meter, the mouthpiece. The patient has to inspire. Now, I gave an example. The patient has inspired. You get 52 centimeter H2O. Now, go with the low training intensity. The study says that minimal load of 30% of pre-MIP. So 30 by 100 is multiplied into 52. So the answer is 15.6. So you have to set the load on the device. First, see the MIP, go for the 30 percentage, you get the answer of 15.6, and then you have to set with the minimal load, because directly you can't go for the maximal load. Start with the minimal load. So then I give an example, it's 15.6, and then slowly it has to progressively increased. That's why it's very important to see the MIP, because you have to see the outcome measure. It's a form of outcome measure, and that determines your loading intensity in the intervention, whether it is POWERBREAThe Plus or whether it is threshold IMT. Yes, sir.
Fine, sir. Question from the same person, Miss Jyoti Naidu. Can you suggest some devices for
Yes, sir.
PI Max?
PI Max, like yeah, as I told you, this is just a minute. You're able to see the screen, sir? You're able to see
Yeah,
the screen?
yeah, sir.
Okay. So this is a device MIP. One of the devices is what can be done is, if this device is not available, there are other devices. You can go even for the manual pressure meter that is widely available. Like not it's called, rather than going for digital device, you can go for the manual pressure manometer, where you can connect a plastic tube can be connected with the manual pressure meter. You find the dials. So I think you can go for even for the manual pressure meter, because this digital PI Max, that is these devices, are quite expensive of 1 lakh. So go for the traditional, for the manual pressure meter devices. Okay. Yeah.
Yes,
I have
sir.
not put the image of manual pressure meter, but I hope you understood what do you mean by manual pressure meter. It's similar like the manual pressure meter which you see in the above the suction apparatus. Remove it and you can connect the plastic tube and you can check the PI Max. If you don't get the micro RPM respiratory pressure meter devices. Yes, sir.
Fine, sir. Chandramohan, sir. And
Yes,
Jyoti Naidu
Rupesh.
have
Yes,
given
Rupesh.
thanks message.
Yeah.
Yeah, sir.
Any other questions, Rupesh?
No, sir.
Okay. Okay, we will conclude now. Then, Madam Duna, Madam wants to check any questions in YouTube. Then we will conclude. No questions. Okay, thank you. Thank you so much, Dr. Vishnu Vardhan, for
Yeah, thank you.
teaching us once again in this ExRx India web series platform, and hope
Yes, sir.
we
Thank you,
will
sir.
be joining with you again on September 8th because we are planning for a
Okay.
celebration and also for a world record last episode. So
Yeah.
I'm making
Yeah.
invitations. We will send it to you. Kindly join with us. If you are missing on the world record
Yes,
event or
sir.
episode, you can join with us in the celebration session. And I request
Okay,
all the
sir. Definitely.
participants also keep supporting us. We are nearing just 10 days more. And thank you, everyone. Thank you, Vairo, our new host today, Vairo Sudarshan, sports physiotherapist, joining with us. And I thank, once again, I thank Vijay Kumar sir for helping me to approach so many resource persons and to reach to Vishnu Vardhan sir too. Thank you, ExRx India team members, Dr. Rupesh, Professor Duna. Sorry.
Yeah, take care. No.
Sorry. And I thank Ms. Simran,
Take
Ms.
care of
Uma,
yourself.
and Alisha. Yeah. Thank you, everyone. Bye-bye. Good night.
Thank you, sir. Thank you, everyone.
Thank you.
Thank you for Dr. Chandramohan and the technical team. Thank you once again.
Welcome.